Welcome, everyone, to our COVID-19 Global Conversation Series, hosted by the Henry M. Jackson School of International Studies at the University of Washington in Seattle. Thanks very much for being here. I'm Danny Hoffman. I'm a faculty member in the Jackson School and the chair of the African Studies program. And it's my pleasure to welcome today Mohammed K. Dunbar, speaking to us from Monrovia, Liberia. Mohammed is a research and surveillance officer with the Ministry of Health in Liberia. And Mohammed, thank you so much for joining us in what I know is a very stressful and busy time.
Yeah, thank you. And it's a privilege for me being on your platform. Yeah.
Great. Thank you so much. So just given that we're having a short conversation, just to let people know, there will be a little bit more about both of us in the links at the attached to this this interview. But Mohammed, I wonder if we could start, if you could tell us just a little bit about what the situation is like in Liberia right now in terms of the COVID outbreak.
Well, it's like alarm our health system because, I mean, we have been having continuous confirmed cases being reported from communities and from other places that it is difficult to still establish an epi link or the index case of that. So yeah, the case is significantly increasing on a daily, on a weekly basis. Yeah.
And it looked like the latest numbers were that we have, it's what, 152 confirmed cases and 18 deaths. Does that sound right?
Yes, that is pretty right. And in fact, as we speak now, the number might increase because that is the last report that was provided. And as we speak, maybe from yesterday and today, there have been some new changes in the number of cases of death, and maybe by tomorrow we'll get the most accurate information as what is the real situation. Yeah, but that statistic you raised is exactly correct.
Okay, great. And just to let people who are watching know, we have we're doing this on a link that has a little bit of a video delay. So but we're getting you loud and clear. So can you say a little bit about what the atmosphere is like in Monrovia right now? How are people feeling on the streets?
Basically, the atmosphere in Liberia is like confusing right now as we speak because the national government have imposed a complete lockdown on the country nationwide. They declare a public health emergency, and now. But one of the major problems we are facing in Liberia is like our pre-existing condition before this COVID-19. Liberia is a country that 60 to 70% of the population depend on informal sector. So they have to go and look for a job on a daily basis before they feed their family. And we have had continuous health problems that have not been solved, that have not been addressed. And coupled with this COVID-19, it have overburdened the health system, it have overburdened the health outcome, it have overburdened the livelihood of the local population. So it is a very serious crisis that we are going through, but we hope it can be handled by the government. But there are some misinformation also coming from both from the government and the population. So we need to be very, very careful in how we get information and how we move forward with this approach.
So can you say a little bit more about the problem of misinformation? What does that look like? What does that mean?
Yeah, the misinformation, even sometimes it comes from even the government messages they give or the regulation from national government, like from the Ministry of Health to the Public Health Institute and some other senior government politicians. It's like now the government is somehow imposing a complete mandatory using of face and nose masks when you are going into the public space. And the usage of that, how it's handled, how it is managed, and the message is not direct. The government have banned public gathering, like schools are closed, marketplaces are controlled, and a lot of non-essential job businesses are considered closed. And now it is creating a lot of problem, even like on a local level. I mean, we are not seeing like they saying that we normally say in Liberia, say what I do, but don't do what I say. It's that basically the government officials are always saying something else and they are doing something else, especially when it comes to the senior level, the heavyweight politicians. And also because most of the confirmed cases we are having in Liberia, they are senior government officials or who be people in authority. So if the local man can say, oh, but this is not affecting us, it's affecting you guys in a hierarchy that are making those decisions, assuming you guys are not adhering to what you are saying. So it's the general population is like they are confused. They don't know who to listen to and what to do now to some extent.
That's interesting. So, yeah, that's one of the questions I wanted to ask you about. So we're about halfway through the term of President George Weah, right? And Weah was one of the politicians that, like many around the globe, that was elected as a kind of outsider political figure. So it sounds like how would you say people are regarding his handling of the crisis?
To speak for the general population is somehow difficult, but because I live here and have been here throughout, so I would like speak on what I think is my opinion and what I think is happening around. Basically, with no doubt, President George Weah is the icon, is still famous, is still well respected, well listened to in Liberia as we speak. But there are also a lot of issues with how he's handling this situation. Specifically, we all know George Weah is the president of the Republic of Liberia, and sometimes people tend to find it difficult to understand why with the president of Liberia would be distributing like bucket, disinfectant, and other things to communities members to help curtail the outbreak, and he's using his personal photo, his personal picture on those gifts that he's giving, all those approach he's carrying on. So people are considering it like it's like a pre-campaigning or trying to sell himself instead of selling the agenda or the fight that the health practitioners are preaching. And being politician, you won't have everyone listening to you and believe in what you say, but so it seems to have a divided opinion among the general population, and some people feel it is right, some people feel it is not right, but I think it's having a mixed signal around the general population of the country.
Interesting. And you said that most of many of the confirmed cases are actually government officials or sort of more elite figures. Is that did I understand that correctly?
Yes, that is like as we speak currently, the Minister of Justice of the Republic of Liberia is currently tested positive. He's at a treatment center. And last week, a few days ago, the Minister of Information of the Republic of Liberia is the latest to be tested positive. And few days back, the president was saying on social media having a conference call with other West African leaders, and this Minister of Information was seen publicly sitting right behind the president. And after a few days, his test result came positive. And now there is a serious concern among the general population if the president was a probable or a case or the contact of this person that was tested positive. So they are concerned for the president to try to do a test publicly and announce a result to alleviate the doubt and to create more trust in the health system and in the approach that the government is pushing, because the government wants for all high-risk contacts that will be listed should stay and monitor themselves for the period of 14 days, or if they see any sign or symptom of the virus, they should come for voluntary testing or they should report to the health facility. And we are not seeing that from the president yet, but so I say those are some of the issues we are having from the general perspective of the population.
And has the president been resistant to making his test public, or is it just not happened yet?
I can't speak to that, but we just get information sometimes from the media, from the news, and like few days ago, like the president was saying himself driving around the city, inspecting a various erected checkpoints, and in fact distributing some face masks to security personnel, and after with some media personnel. So I mean, he was seen physically like a few days ago, and yes, he's seen, but maybe I don't know about the issue of a test result.
Okay, so that
I can speak to that.
yeah, that raises another important question, which is, I think we're hearing the news that we're hearing on this side from across sub-Saharan Africa is that the security forces are being deployed to enforce the quarantine, sometimes with a heavy hand. Has that been the case in Liberia as well?
I would say yes, there have been a lot of cases reported, and we have been able to see some, in fact, on social media platform, like we have a lot of active live stream social media generally going on in Liberia right now. Sometimes you even see a complete misunderstanding among those security apparatus sometimes, because the coordination, they have other security, the DEA, drugs enforcement officer, they have all of them at those checkpoints. Sometimes the issue of who should come, who should go is also challenged among themselves. And as we speak, we should be giving passes. Sometimes it is an issue of pass, and you need to have this access pass, and this access pass, we don't know how easily is it obtained. And sometimes there are a lot of misunderstanding on how to enforce the lockdown. Yes, we have seen some cases like that in Liberia, personally.
Okay. And I'm curious, I mean, Liberia is only, a few years out from the 2014 to 2016 Ebola outbreak, which I know you were involved in the Ebola response as well. But is there a sense that people know how to handle this kind of quarantine and pandemic, given that it happens on such a large scale not that long ago? Or does this feel like it's a different situation?
Well, from the inception, yeah, it was the expectation of even us, the Liberian, that, oh yes, we have this under control. I mean, we have the means, we have the capability, we have the capacity, we have the expertise to handle the situation. But to our greatest surprise, we were taken by surprise by having a confirmed cases that were brought in that we should have detected from the port of entry, because sometimes we have people posted at the very point of entry, that is the airport and the seaport, to screen people who are coming from high-risk country at the time. And our index case in Liberia happened to be also a government official who had just returned from Europe on a government official mission. So how that person came through the security or through the health regulation that was not detected and had to be symptomatic, take himself to the testing center and was tested positive, that was the index case in Liberia. And now we are still seeing government officials are coming down positive. And so the issue is, are we doing what we are saying? Are the government official, are the health regulator, are the general policy maker adhering to the policies that are being laid that the population should adhere to? So like when it comes to our preparedness, yeah, it was the expectation of everyone that Liberia wouldn't have been taken by surprise with the system having in place, with the investment after the Ebola crisis. But I think that have to do with some political issues, some political decision. I think it's the issue of leadership on that. Yeah, but we have the capacity, we have the expertise, we have the personnel to handle situation, but because of some political involvement, some political interest, and so things are getting messy, I would say.
And when you say political interest, could you say a little bit more about what you mean by that? Is it a question of corruption, or is there something else going on as well?
As usual, corruption cannot be ruled out from most of the things we do when it comes to public management, when it comes to our governance system. But I mean, putting people in charge that know how to handle the situation, because now people are giving people tax and responsibility because of their political affiliation with maybe the authority or the influence they have. So some extent, they are not looking for the qualified personnel, or they are not giving task and responsibility to those institutions and individuals to carry on the job. They have some new players who are, quote unquote, linked to the power, linked to the authority, and they don't have much experience when it comes to handling this or implementing those measures. So those are some of the issues I have seen happening over the period of management.
And so on that note, do you think that, and I know in many ways we're still at the early stages of this outbreak, but do you anticipate that this could have long-term political consequences?
Yes, it will have long-term political consequences. I think, in fact, politicians are taking this COVID-19 outbreak to be a means of campaigning, pre-campaigning, because very soon, 2023, we should be going into our next presidential election for both lawmakers and the president. So now people are taking this time, instead of consolidating effort to combat this disease we are having, but people are politicizing issue. People want to gain political points so they can have as a talking point when it comes to elections. So I sure we are politicizing the issue a lot. We are not giving the health authority the support and the needed resources to handle this situation appropriately. But instead, the fund is being translated to other political players who will use it for alternative motive.
And is there any is there a single person or a single voice that's turning out to be the primary opposition when it comes to COVID, or is it coming from lots of different places?
It's coming from a lot of different places, and one of the group that is being left out and is very crucial in handling the outbreak we are having, especially because based on lessons learned from the Ebola crisis, was the religious leader and the community's leaders, community involvement. Yes. So we need to consider various community leadership that was in place then. We worked then with the religious council, the religious community. Like now there's a complete lockdown on all religious activity. People are not going to churches, people are not going to mosques. And I don't know how long this is going to continue, because once people start being impatient or they are not receiving that hope and that confidence in the health measure being put in place, I'm seeing a backsliding on that, and will result into the general population being resentful of the approach. That's going to have mass consequences. Because we noticed from the Ebola crisis, the infection at the time started from rural communities, came to the capital city where we have a big urban slum, and the virus spread a lot. But now what we are seeing, cases have been reported from the urban city, like Monrovia, is going out to other counties, other rural communities. And the fear is, if we have the virus will carry in those rural communities, how are we prepared to isolate and to contain the spread of the virus, where you will not restrict people? I mean, we live the average household in most of the urban communities here is 6-7 persons in one home. How are you going to tell them to observe social distancing? In fact, where are you going to have those people find food to eat and find things to do when they are to be locked down continuously? So those are things I think we should be looking at in a much looking at solution from the health intervention as well.
Right. And I'm curious, was the lockdown on religious services, and was that also a part of, that was also a part of the Ebola response too, right? Was that, were those gatherings suspended during Ebola as well?
Yeah, at some point at the peak of the spread, yeah, we had to carry on messages where people were avoiding grouping or going to religious places, because we noticed cases were going to the religious home for prayer and for other healing, and that was another source of infection or spreading the virus then. But now, since we all know the COVID-19 is also, we need to observe social distancing and to keep distance away, and people going to those religious places. Like now, this is a month of Ramadan. The Muslims community is also fully adhering to the government regulation. They are not going to mosque as usual, and the churches are all closed on Sunday. The pastors are all having live messages they've been sending through social and platform to their congregation, and that is working for now. But how long are we going to continue like this? I think we need to think about finding our exit strategy now, because I mean, you won't lock down the country for time indefinite. We have to work it up, like similar thing that is happening in the US. We're seeing people are getting frustrated with the continuous lockdown. So.
No, for sure. And actually, I wanted to. The other thing that you talked about was the movement out of the city into the villages. And one of the things that was true during the war in Liberia and also during Ebola was that communities would sometimes mobilize themselves to isolate the communities, set up checkpoints, keep strangers out. Do you see that kind of grassroots security movement happening already?
Oh yes, that is almost in every community I have tried to go in a few days. For everywhere, in fact, they have checkpoints that are established by community volunteers, and they have washing hand station. If you are in a vehicle, you have to stop and get down and wash your hand before you enter this community. And some places, they even collect data. They ask you for your name. Where are you from? Who are you going to see? And all of those, some communities are doing it. So that is a good thing. But how long that's going to continue? Because it's now turning to something else. You know, if you continuously keep people in the street, they want to find means to pay themselves. So as a result now, those guys posted at those checkpoints, they continue now beginning to ask people for lay hand up to buy detergent, to get water, and to like accommodate themselves for food. So it's going to basically be looking at another source of revenue generation for those guys. So to get them out of there, and it could also serve another means of spurring, now also observing the social distancing in the interest of helping. It's just getting confusing. So somehow to say.
And do those checkpoints, are there police or military present usually, or is it purely a local youth movements?
Yeah, the ones in the community, they are purely local community volunteer, community youth. Yeah, they are doing it. But at the major checkpoints where the government had is joint security forces, there are some major interception and some major point of connection where they stop people and ask you where you are coming from, try to enforce the government lockdown policy. Yeah. Okay. So they have security people at some specific location, but most places in community, they are all community volunteers. Yeah.
And are those kinds of community efforts, are they truly supported by the communities, or is this tend to be, are people concerned about this?
It's just supported by a concerned individual and through what they get from those people. And sometimes other faith-based, other politicians, other groups try to come identify, but it's not something sustainable. It's not very effective for me. It's just putting people at in harm's way to me. Because these people, they are just youth. They are not also observing any form of the health regulation. The only thing they are there, when you stop, they come to you, wash your hands, that's all. And it's not just auto it. Yeah.
It's a little like the iron gates, huh?
Yeah. You know, I mean, I'm sorry to say, we have been accustomed to some form of lawlessness always. So people tend to feel empowered when they are somewhere where they think they have authority. Sometimes you are just coming, they just aggressively come and talk to you. Oh, come and wash your hands, as if to say you don't know what you are even doing for yourself. So, and they have no restriction on age limit, on qualification, experience. They just get people from anywhere. You just find yourself there.
And who's organizing those, do you think?
I think just some community youth come together, some community volunteers, because it started a few weeks back when the contact tracing or the active case search was supposedly to be handled by the Monrovia City Corporation, where it was also another political approach, a partisan level of gathering people. These young politicians, they want to supply the fan base with some form of employment or job during the crisis. So they just group part of party member and loyalists and told them, oh, we'll find you guys a job to go in the community to carry on awareness and sensitization. And train health workers that were trained during the Ebola crisis to do contact tracing or to do case to be awareness in community were left out completely.
Really?
So yeah, there was some. I will try to send an article to where the city corporation recruited 6,000 youth for just Monrovia alone to have them sent to the rural community to do case search or active case. I know what to really do, but it was also heavily contested by the general population and some health personnel, and there were some things done about it. So it was when this community group organization started to come about. But personally, the structure that were in place during the bureaucracy had not been followed, had not been taken into consideration. They came up with new system, new group of people, everything. So yeah, that's the bad thing.
Right. So I wonder if you could say a little bit about your personal experience with this crisis. You're on the front lines of this work. How's it affecting you? How are you holding up?
Well, for me personally, I mean, we are all being affected one way or the other. Like from my extended family, personally, we have 5 members of our family, external family member, that were tested positive.
Oh, wow.
And because they went early enough for treatment, and they are all discharged now. So this is just me adding my voice to the many voices around the world that this is real. This is not a myth. This is not a story. It's real. The virus is in Liberia. It is spreading, and we have to find means to contain the spread. So we should adhere to all health measure, health regulation, observe social distancing, wear face masks, and when you are going to public, and wear it properly, and also stay home if you don't have any reason to go out till we can have control. And we put every sign as early as possible to go for treatment as early as possible. Yeah, right. That's what I can say. But yeah, it's affecting our job, it's affecting our livelihood, it's affecting everything. So.
Yeah, I know these are scary and difficult times. So I want to, first of all, just thank you so much for taking the time to be here with us. And I want to wish you the best, your family, everybody in Monrovia, all Liberians. We'll be thinking about them and keeping an eye on things.
Okay. Oh, thank you. It was nice talking to you, and I hope together we can combat this virus.
I hope so too. Thank you.